memories, dreams, and reflections should consist of jelly is simply too strange to understand. All I can see in front of me is matter. Yet I know that if I stray into the wrong area, into what neurosurgeons call eloquent brain, I will be faced by a damaged and disabled patient when I go round to the recovery ward after the operation to see what I have achieved. Brain surgery is dangerous, and modern technology has only reduced the risk to a certain extent. I can use a form of GPS for brain surgery called computer navigation, where, like satellites orbiting the Earth, infrared cameras face the patient's head. The cameras can see the instruments in my hands, which have little reflected balls attached to them. A computer connected to the cameras then shows me the position of my instruments in my patient's brain on a scan done shortly before the operation. I can operate with the patient awake under local anesthetic so that I can identify the eloquent areas of the brain by stimulating the brain with an electrode. The patient is given simple tasks to perform by my anaesthetist so that we can see if I am causing any damage as the operation proceeds. If I am operating on the spinal cord, which is even more vulnerable than the brain, I can use a method of electrical stimulation known as evoked potentials to warn me if I am about to cause paralysis. Despite all this technology, neurosurgery is still dangerous. Skill and experience are still required as my instruments sink into the brain or spinal cord, and I must know when to stop. Often it is better to leave the patient's disease to run its natural course and not to operate at all. And then there is luck, both good luck and bad luck. And as I become more and more experienced, it seems that luck becomes ever more important. I had a patient to operate on with a tumour of the pineal gland. In the 17th century, the dualist philosopher Descartes, who argued that mind and brain are entirely separate entities, placed the human soul in the pineal gland. It was here, he said, that the material brain, in some magical and mysterious way, communicates with the mind and with the immaterial soul. I don't know what he would have said if he could have seen my patients looking at their own brains on a video monitor, as some of them do when I operate under local anesthetic. Pineal tumours are very rare. They can be benign and they can be malignant. The benign ones do not necessarily need treatment. The malignant ones can be treated with radiotherapy and chemotherapy, but can still prove fatal. In the past, they were considered to be inoperable, but with modern microscopic neurosurgery, this is no longer the case. It is usually now thought necessary to operate at least to obtain a biopsy and confirm the type of tumour, so that you can decide how best to treat the patient. The pineal is buried deep in the middle of the brain, so the operation is, as surgeons say, a challenge. Neurosurgeons look at brain scans showing pineal tumours with both fear and excitement, like mountaineers looking up at a great peak that they hope to climb. This particular patient had found it very hard to accept that he had a life-threatening illness and that his life was now out of his control. He was a high-powered company director. He had thought that the headaches which had started to wake him at night were caused by the stress of having had to sack so many of his employees in the aftermath of the financial crash of 2008. It turned out that he had a pineal tumour and acute hydrocephalus. The tumour was obstructing the normal circulation of cerebrospinal fluid around his brain, and the trapped fluid was increasing the pressure in his head. Without treatment, he would go blind and die within a matter of weeks. I had had many anxious conversations with him over the...
To keep listening to this audiobook, I've left you a link in the description so you can do it, at no cost thanks to Audible's 30-day free trial.